Here at the Cardiac Cath Lab we see over 500 patients per year who've had a heart attack and unfortunately had to come to hospital because of that. And it's the vast majority of people who will do well and get home, but we see exercise as a key part of recovery after a heart attack.
It's really important that we encourage people to self-manage, and part of this process is to link them with projects that are within the community, and that's where Highlife Highland lies. So the first point of that is making sure people are attending exercise assessment with our cardiac rehab physiotherapist. We have those based around the Highlands. And the second part is if they need a physiotherapist supported class, they do that first. If, however, somebody doesn't need that extra support, they can go straight onto the Highlife Highland exercise classes, which are now available in their community setting.
Traditionally we used to bring people back to the hospital for their cardiac rehab programme, but we realised that delivering exercise-based classes closer to home is much important, especially in a dispersed population like we have in NHS Highland.
The class that we run in Invergordon is a community-based class, so it's in a non-medical setting. So that gives people huge confidence because it enables them to realise what they're able to do without necessarily being in a hospital. Gentle warm-up, much longer warm-up than you do in a normal class.
I come to this class because I want to be able to help myself to achieve what I'm capable of. When this happens to you, you're sometimes a wee bit frightened and you don't know how much to push yourself.
You did well last week on your increased ratio. So what do you feel about doing that again?
That's fine. But this class teaches you that, and I love it.
Coming along here is the best thing that ever happened. To me personally, I think I've already saved the NHS a wee fortune, because there's no doubt I would have been at hospital for some reason. I used to exercise myself, but I didn't know when to stop or when to start. There was no such a thing as warming up or warming down, and this is a revelation for me.
I'd never done exercise before, and gives you motivation to actually keep going. Now that I've started, I don't want actually to stop the class.
This is a great idea because what it does, it allows some peer interaction between people that have been through the same type of experience, but in a less hospitalised environment. It's really important that people get to exercise locally, get to meet people locally, and also build on that repertoire of things that they can attend in the local community and within the Highlife Highland Leisure centres.
I was isolated, I was doing things myself, I couldn't speak and share about my heart problem. And since then, I'm just, if the family's noticed, I'm in better shape. I'm a bit heavy yet, but you know, that I can do all those exercises and push myself, knowing that somebody's there looking after us.
From a fitness point of view, we can clearly see people's improvements in their endurance and strength, etc. But the main feedback we get is more of a psychological improvement. So people are feeling far more confident about going about their daily life. So most people are, if they've had a cardiac event, they'll suddenly feel a little bit nervous about doing normal activities. So for us, it's great to hear that people can get their normal kind of lifestyle back and feel confident about taking part in exercise or whatever it is they're looking to do.
The sooner you start, the better it is. And you get some friends with you to help you persevere in the exercise. That's the best thing to do.
I think it's one of the most rewarding classes that I teach. You can see the relief and the joy on the participants' faces as they realise what they can do. And it's like enabling life. We enable them to go forward with what they want to do.
It really does open your eyes. You know how far you can push yourself. People are keeping their eye on you to make sure you don't go over the top. And this just proves that you can do more than you think.
After you've done some physical exercise, you are always going to feel better for the rest of the day.
Highlife are just looking to really develop the resources that people can use, and because we're so diverse and we're all over the Highlands, we're looking to roll this out in numerous locations. We're looking at things like online support and phone call interventions and these sort of things as well. So we're looking at training more staff and just really linking in more with the NHS and just signposting people to different options really.
It's not just about the immediate recovery after a heart attack. We're looking for lifelong changes to patients to ensure that they remain as happy and healthy and away from us for as long as possible.
You've not got a fear, you've not got a reticence, you've not got any anxiety of coming. You're actually quite looking forward. As my grandchildren would say, you're buzzing to come.